Is the use of Gen AI ethical to use and promote in the context of nursing practice? Does it let us work quicker, or does it increase our risk? I believe it is the latter. But what is Gen AI, and why do we not want to use it in nursing? My name is Nadia, and today we will be exploring these ideas. Generative artificial intelligence, or Gen AI, are artificial intelligence models that use information available online to generate a response. They access websites, videos, pictures, and any other media publicly available to generate their responses. This can include scientific journals, YouTube videos, other websites, no matter who published them or when they were published. Programs like ChatGPT and Claude generate responses using a language learning model. This may be useful to some, but we often don't know where this information is actually coming from. This is a phenomenon known as a black box. The ability to consistently identify quality sources is questionable. As well, these programs are becoming more and more common in our daily lives. And as they do, they are becoming more and more prevalent in the healthcare sphere. When Gen AI is used as a search engine for advice, is it giving nurses and patients the same information? Is this information recommended or even relevant? Now, I believe, based on current limitations in the technology and research quality and reliable data collection, implications in documented cases of mental health deterioration, and evidence of biases, I cannot say that the use of generative AI as a healthcare professional would be in the best interests of both nurses and their patients. Now, nurses are required to follow the College of Registered Nurses of Saskatchewan, or CRNS, Code of Conduct, and show proficiency in entry-level competencies. The CRNS Code of Conduct section on Integrity 5.10 states RNs must be truthful in their professional practice, which also refers to giving accurate information. And there are 3 entry-level competencies described by the CRNS, and they state, the RN incorporates mental health promotion when providing nursing care, the RN incorporates suicide prevention approaches when providing nursing care, and the RN advocates for health equity for all, especially those who are most vulnerable. Now, it is stated on OpenAI's information page, there is an inherent element of randomness in how the model responds. As a result, the same question may yield different answers based on the same question. This poses risks to both nurses, who are responsible for safe and evidence-informed care, and patients who put their trust into nurses providing them accurate information. As mentioned previously, many Gen AI take sources from across the web, but this means they can pick up information that is simply not true. In a study on these hallucinations, it was found that conventional chatbots like ChatGPT have hallucination rates as high as 40% of the time, 4 out of your 10 searches. In alignment with the CRNS Code of Conduct, Section 5.10, it is important as nurses to be providing safe and accurate information to our patients, and that information is clear and consistent. Due to the black box effect, we cannot verify the sources it draws from. Using or promoting Gen AI to patients increases the risk of perpetuating misinformation and has the potential to promote or recommend unsafe practices. Some of this misinformation has caused the most serious damage has been related to mental health. In an attempt to receive advice, connection, suggestions, some people have been using Gen AI chatbots like ChatGPT in place of therapists, psychiatrists, or even friends. In California, the responses being generated have led to 7 lawsuits in the state. In 4 of these 7 lawsuits, the use of Gen AI chatbots as replacement for mental health care has led to death by suicide. The other 3 led to inpatient psychiatric care and psychosis. Now, when we take a look at the CRNS competencies 1.19 and 120, they state the RN must provide mental health promotion and suicide prevention strategies into their nursing care. The use and promotion of generative AI in healthcare does not align with these competencies as we see in the state of California. Nurses have a duty to provide safe, ethical, and reasonable care to their patients. I do not believe that using and promoting a program that is known to lead to unfavorable health outcomes is the responsible action of a registered nurse in the province of Saskatchewan. As well as mental health and health risks, we also see equity concerns. As Gen AI gathers information from everywhere, it also picks up biases. In a 2025 study, it was said that due to the language learning models of Gen AI, they have the very real ability to pick up biases and reduce equity when used within our healthcare system, including based on gender or race. When we look again at the CRNS entry-level competencies, we look at 7.4. Nurses have a responsibility to advocate for the health equity of all. If Gen AI is promoting biased or inequitable information, it does not align with the basics of nursing practice. This could lead to worse health outcomes for vulnerable populations, which does not align with nursing practice. Another CRNS competency states, nurses are able to contribute to, use, and evaluate new knowledge and technology relevant to the area and nature of the practice setting. This very well could include Gen AI use, but not at the cost of ignoring the known risks and disregarding other competencies that they have to follow. There are many potential uses of Gen AI as it progresses, but in its current state, it poses serious risk for use in professional nursing care. The use of new and generative AI programs, like those developed to compare conventional chatbots to specially trained AI models, could be further developed for use in nursing practice, having safeguards and other quality information, safe advice, health promotion, and equity are what all nurses strive for. Using a program that does not follow those principles is incongruent with quality nursing practice. In their current state, Gen AI programs do not align with these values. Common use of Gen AI in nursing is on the horizon, yet in its current state, using it poses risk to both patient safety and nurses' integrity. From misinformation to causing direct harm, Gen AI in its current state is ill-equipped to answer questions regarding health and healthcare with quality assurance. Yay!
Yippee!
That's fine. It's fine.